I'm going to talk to you today about the treatment and maintenance of pulmonary embolism. Have you ever experienced shortness of breath, stabbing chest pain, clammy or bluish-colored skin, rapid or irregular heartbeat, lightheadedness, wheezing or swelling of the legs? If so, these are many things to be cautious about. Apprehension, restlessness, and a feeling of impending doom may also be evident because of the way these symptoms make you feel. A pulmonary embolism is the collection of a particulate matter, could be solids, liquid, or air, that enters your venous circulation and lodges in the pulmonary vessels. Large emboli obstruct pulmonary blood flow, leading to reduced oxygenation, pulmonary tissue hypoxia, and potential death. Any substance can cause an embolism, but a blood clot is the most common, says Ignatovics and Workman. The diagnosis of a pulmonary embolism can be very life-threatening and demands immediate medical attention. Treatment of pulmonary embolism is extensive and is very important to the safety of one's health. Three more prominent approaches that are commonly seen when treating and maintaining one's health after pulmonary embolism is diagnosed includes being aware and avoiding the causes and risk factors, medication therapy, and surgical procedures. Pulmonary embolism can occur in healthy people and may give no warning. Because of this, prevention of conditions that lead to a pulmonary embolism is a major concern. It is important to be aware of these causes of pulmonary embolism and to avoid them as much as possible. Major risk factors that can lead to pulmonary embolism are prolonged immobility from excessive hospitalization or bed rest, as well as extended travel, central venous catheters, surgery, obesity, advancing age, and conditions that increase blood clotting, as well as a history of thromboembolism. Other causes of PE include hypercoagulability, which is where the blood has an increased clotting potential, any damage to the veins, birth control pills or estrogen therapy, smoking, polycythemia, cancer, heart failure, stroke, pregnancy, trauma to the lower leg with or without casting, and genetic predisposition. There are many lifestyle changes that can be encouraged to help reduce the patient's risk of pulmonary embolism. It is important to encourage the patient to stop smoking, especially for women who take oral contraceptives. It is also important to teach patients who are traveling long distances to drink plenty of water, to change positions frequently, and to avoid crossing the legs, and to get up from the sitting position at least 5 minutes out of every hour. Another important thing for the patient to understand is that reducing weight and becoming more physically active can reduce the risk of PE. While some of these causes cannot be avoided, such as having a condition that increases the blood clotting potential or having a genetic predisposition to PE, being aware of the causes and having the knowledge about what can cause a life-threatening condition such as this is very important in the prevention of the condition reoccurring, especially in those patients who have already experienced signs and symptoms of PE and have been clinically diagnosed with this condition. In addition to being aware of and avoiding the causes of PE, when treating and maintaining a patient's health, after a pulmonary embolism, medication therapy is imperative. Medications can help prevent reoccurrence of pulmonary embolism by preventing new clots from forming and by preventing existing clots from getting larger. Anticoagulants prevent the production of certain proteins that are needed for the blood to clot. Even though anticoagulants can prevent new clots from getting larger, they do not break up or dissolve existing clots. The two most common anticoagulants used to treat PE are heparin and warfarin. Heparin is an anticoagulant that is given by injection. Since it is an injection directly into the bloodstream, it instantly affects the clotting system in the body. There are two types of heparin used: low molecular weight heparin and unfractioned heparin. An example of a low molecular weight heparin that is commonly used when treating blood clot is Lovenox. Lovenox is an anticoagulant that is given by injection into the subcutaneous tissue that is given twice a day. It is used to prevent and treat harmful blood clots. This medication works by keeping the blood flowing smoothly by lowering the activity of clotting proteins in the blood. Warfarin is the generic form of Coumadin, which is an anticoagulant that is taken in pill form. It is usually started while the patient is still being treated with heparin or Lovenox because it takes several days for the oral anticoagulants to build up to a level that is effective. Once the oral anticoagulant is at a therapeutic level, the initial medication, such as heparin or Lovenox, that was being used is stopped and the treatment with the oral anticoagulant continues. For some people, the oral anticoagulant medication may be needed to take for weeks, months, and for some patients indefinitely. There are many oral anticoagulant medications, however, warfarin and Coumadin are the ones that are most commonly used in the treatment of pulmonary embolism. New medications are constantly being created and tested to try and improve medication therapy for different conditions. All of these new medications having their advantages and their disadvantages. A new anticoagulant medication, rivaroxaban, also known as Xarelto, was recently released for the treatment of deep vein thrombosis and pulmonary embolism. In an article written by Margaret Hackstup and Ellen Williams, they discuss the advantages and disadvantages that rivaroxaban has in the treatment of DVT and pulmonary embolism are discussed. The article mentions that rivaroxaban is more effective, more cost-effective, and more convenient than any other anticoagulants. It doesn't require regular anticoagulation monitoring, however, it does require regular renal monitoring. No current readily available tests are available to assess the level of anticoagulation in patients taking this medication. Rivaroxaban contains XA inhibitors, which contain shorter half-lives than the other oral anticoagulants, which means less protection if the patient misses a dose. The biggest concern rivaroxaban poses is that it does not have an antidote, whereas other anticoagulants do. Since there is no antidote, if a patient taking rivaroxaban were to have uncontrolled bleeding, it would take hours for them to stop bleeding. I was once told by my physician it would take around 18 hours before the bleeding would stop. The article states that the introduction of rivaroxaban and similar novel anticoagulants represents a significant change in anticoagulant practice, says Hastrup and Williams. The article made it clear how a new medication is introduced and compared to other medications to determine the risks and benefits compared to existing medications, as well as the process of determining the risk versus the benefits for the patient. Furthermore, there are times when pulmonary embolism is diagnosed and surgery is needed considerably. Some of the common surgical procedures performed are an embolectomy and an inferior vena cava filtration placement. An embolectomy is the surgical removal of the embolus from the pulmonary vessels. It is considered for patients who cannot have any other kind of treatment or for those who cannot wait for medicine to work. An embolectomy may also be performed for a person whose condition is stable but shows no signs of significant reduced blood flow to the pulmonary artery. The doctor threads a thin flexible tube or catheter through the blood vessel and suctions out the clot. Unfortunately, surgery can increase the risk of forming new blood clots, so this is an example of when it is imperative that the doctor outweigh the benefits versus the risk for the patient, and to decide what the best thing would be to do. On the other hand, an inferior vena cava filter placement can also be performed. This is where the catheter is used to place the filter in the main vein, the inferior vena cava, that leads from your legs to the right side of your heart. The filter catches and stops blood clots moving through the bloodstream toward your lungs. In conclusion, pulmonary embolism is a life-threatening diagnosis and should be taken seriously. Treatment and maintenance of pulmonary embolism is very critical and essential to the survival of the patient. 3 common and most prominent approaches that are seen for the treatment and maintenance of this diagnosis include avoiding and being aware of the causes and risk factors, medication therapy, and surgical procedures. A mixture of these can be used when treating pulmonary embolism. As with each medical condition, each patient is individual and may respond differently to different treatment approaches. It is very important to focus on the patient, implement immediate medical treatment if the symptoms noted above occur, and to individualize treatment approaches for each patient necessary in the maintenance of their health and the safety of their lives.